I had a patient who had a rough couple of years. He was missing some of his front teeth. And I remember I was able to do some extractions. I gave him his smile back and he was so appreciative. He was able to feel confident. He was able to go find a better job. So just knowing that you're able to change a person in that way or help them out is really fulfilling. You know, when you talk about what have you left behind, you know, when you've passed over, what have you contributed to society?
Yes.
And it's a hard one, right? Like, what have we done that people will remember us for? And I realized that because I am creating these miniature sculptures and putting them in people's mouths, that's kind of my legacy, because I've created artwork and it's living with them and they're functioning with it and they're smiling with it. So I am leaving behind a piece of me inadvertently with all these people with every restoration I do.
Welcome back to The Doers, the podcast where we dive into the real stories behind building, struggling, and thriving in dentistry. I'm your host, Dan Hall. Each episode, we hear from leaders in the trenches, those doing the work and shaping the future of dentistry. Today, I'm joined by Dr. Penelope Chang, a cosmetic dentist and digital dentist mentor, known for transforming smiles and elevating confidence through her artistry and expertise. Penelope, thank you for joining me on the show today, and welcome. Let's go back to the beginning, Penelope. What drew you to dentistry, and especially cosmetic dentistry, and what made you focus on enhancing smiles?
I think dentistry is very art-driven. I've always had an artistic background, and I like hands-on projects, you know, working with my hands. And I think dentistry really is important because the small things, right? Someone may not like their smile, but the small things like changing the shape of a tooth, changing an edge, changing a corner, changing the shade of a tooth, those little differences really reveal how much more confident a person becomes when they can smile confidently like that. So that's where it kind of hooked me in. Like I can make someone feel so much better about themselves just by making maybe a small change. And then you get big changes too, which is a whole nother story, right?
Okay, no, that's fascinating. So when you say like the art side of it, you said you've always been involved with that. Like in what way?
Some of my hobbies are stained glass. I've done stained glass windows and lamps. My other thing is lamp working. So it's really taking a glass rod and a metal rod in front of an open flame, and you're melting the glass and creating beadwork with it. So
very cool.
That's a very dexterous hand-eye coordination required thing. So it's fun. You create art with that.
Oh, so you're actually firing it and working with it at that level when you're doing this glass work. Okay, so this is something that's always been a passion.
It's fun. Anything you can create with your hands, I think, and be able to share with other people is very self-fulfilling.
Okay, yeah, it's got to be, as we talk about that, cosmetic work can be deeply personal for patients. Mm-hmm. How do you approach that sensitivity with your patients within your practice?
I think it's important to listen. You have to listen to the patients, listen to what they want, what they're looking for. I think you also have to be able to show them in a way that they can visualize it. Some people can visualize things easily in their minds, and other people need an actual visual representation to look at. So in my practice, we like to use technology. Photographs are important. You can manipulate photographs with an app. You can modify and change and do a projection of, well, this is what your tooth could look like, or this is what your smile could look like. You can also go into digital wax-ups or a mock-up or something like that, where you can actually scan their teeth and have it designed, and you can present it to them and say, look, this is where your smile is now. This is what we can achieve. And the best part about digital is that you can now take that digital wax up or creation, and that can be transformed into the final product because there's a reference point.
Oh, I love that. I mean, especially myself, I'm a highly visual individual, so I can only imagine like when you're showing them, and maybe even there's that tact, like you can feel it, right? If you're giving them that model, that's awesome. Do you mind sharing like a memorable case that reinforced your passion around the artistic side of cosmetic dentistry as well as the transformative piece, practitioner?
So way back when I first started in the first couple of years, and this is before CEREC and digital and all that stuff, I had a patient who had a rough couple of years, he was missing some of his front teeth. One of his remaining front teeth had drifted, so he looked like he had a single tooth in the middle of his midline of his smile. And I remember I was able to do some extractions. We made a partial, and it's not like implants or anything. It's just a simple partial that gave him his smile back. And he was so appreciative. He was able to feel confident. He was able to go find a better job. So just knowing that you're able to change a person in that way or help them out is really fulfilling. So from there, CEREC came into play for me about 10 years ago. And that's where it got really fun, because now I am in control. Like, I'm the artist. I can control. Before CEREC, you could do scans, you would take impressions, you would send to the lab, and the lab was the artist, right? You just gave them the basis. They would create the artwork. The problem is that sometimes their vision and what your vision for the patient may not have coincided. And so there'd be remakes and things like that. But now with CEREC and same day chairside dentistry, I'm in control. I can control the shape. I can control the stain and glaze, the color. I involve the patient. I make sure they look at it and say, do you like the shape? Do you look at it from all different sides? Is this what you want? Do you want it darker? Do you think, we need to enhance it in some way? So I make them very involved also. And I know other doctors don't like to do that, but I like to do that because I think it gives the patient ownership, right? They help be part of the process. And in essence, they've been listened to, and they can put their word in also. And so whatever the final outcome is, they own it, and they like it, and they appreciate it.
Well, yeah, and I bet it feeds that artistic side. Because
Yes.
I'm just thinking of the story you're telling about working with the glass, right?
Mm-hmm.
Now you own that whole process, so it must feed you a little bit internally as well, too. So we've talked a little bit about just like the feel-good stuff,
Mm-hmm.
and now every business comes with challenges, right?
Yes.
So I'm wondering, what was one of the most difficult moments you faced as you were building your practice?
I think building a practice from scratch is really hard. I had a practice with my father, and things happened, so I ended up working and opening my own practice. I was fortunate enough that about 80 patients follow me from New York City, which is fantastic, not to start with 0 patients, but have a small group that, was able to come, and that made you feel good because they were willing to travel. And I think the hardest part there is just waiting for the patients to come to you, right? There's going to be slow days. There's going to be busy days. And on the slow days in the beginning, you would freak out. You would get really nervous. You'd be anxious. Oh my gosh, I'm going to make it. And now we're at the point where if I have a slow day, I'm just like, hooray, I can actually take that time and do something else. So I don't agonize over that anymore. But I think it's patience and having a good support system is really what's going to help through those difficult times.
So that's what you see as one of the main pieces that helped you push through.
The support, yes.
Okay.
Yeah.
And just for context, since I'm not sure, I mean, I know you're based in New Jersey, but like when you say they left New York and traveled to where you're at today, like what type of commute was that for these patients?
Some of them would travel even to this day. They travel from Queens to New Jersey. I mean, that's like if you drive maybe 40 minutes. I've had people move to southern mid-Jersey who will come drive over an hour to come see me. I had someone who actually moved to Virginia who comes twice a year to come see me. And, I really appreciate the loyalty that they have.
Yeah, that's amazing. Because, I mean, they're driving by hundreds, maybe thousands of practices to come see you. That's an amazing story. So in the field where expectations are high, and how do you handle patient satisfaction and manage expectations?
I think you have to remember not to promise them 100% of everything, right? I just read somewhere, strive for perfection, but aim for excellence. So you want to make sure you don't overpromise to the patient, but I also want to make sure I involve the patient so that they are part of what the outcome is, like I said. You just have to listen also, like I said. You need to talk to them and understand what they're looking for. And I think when you have that communication going on, your outcomes are going to be better.
So Penelope, how do you balance the artistic vision and the clinical practicality being a cosmetic dentist?
So I think having technology really helps. CAD/CAM dentistry is really important. It satisfies the artistic side where you're in control of creating your restoration, but the digital workflow is really important for keeping everything on track. I help mentor at CEREC Doctors, which is a continuing education course school, I guess you would put it. And we teach doctors who are new to CAD/CAM dentistry about how important digital workflow is. That's what's going to make you more efficient and make the most of your time. And chairside dentistry, like you know, is same day. So we get the patient in, we prep, we impress, we create, we seat, and they are out. There's no coming back for another visit. There's no temporaries. Everything is super efficient in that way.
Okay, that's awesome. That must help too with those folks that travel to see you,
Yes.
right? On that 45-minute drive.
Yeah.
They know they're going to come in and get it all done that day. So going into your leadership style, working in detail-orientated and same-day dentistry might be high pressure at some points, I'm guessing, or maybe not in your case. And you can answer this question. How do you describe your leadership style in the setting to be running at such precision?
So I'm a small practice, so I'm a little bit different from everybody else. It's me, my assistant, and my patient coordinator up front. I still like to be in control, not micromanaging, but I like the process. I like the artistic process. So I personally like to do the restorations. I like to be in charge, and I could teach an assistant to do it. But for me, that's part of the pleasure, right, is to actually create and fabricate the restorations. I do keep everyone involved. Everyone knows that their voice is important. My assistant's voice is very important. I will ask her, because she sits in a different position than I do, look at the restoration with me. What do you see? Where can we improve on this? Is this line angle correct? How can we make this better? I'll give the patient also a mirror and say, what do you see from your point of view? So I want to keep everyone involved. And I think that's super important. So my leadership style really is to not micromanage, but really to have everyone else have their voice and feel free to contribute to the whole experience and to the case, and not just say, I'm the one who's in charge. I need everybody's input together.
What's amazing, though, it sounds like a little bit of you throw your mentor hat on with your assistant and working them through the process to continuously upskill them. I mean, kudos to you. I mean, you'll see a lot of people could just get caught up in the moment of getting through the case and not, bringing just the patient up to speed, but also their staff and what they're doing and taking their input.
Well, I think it's important for staff to know what you're doing, the reason why you're doing it, because then they appreciate what they're doing better. Instead of just being a pair of hands, knowing why they're doing certain things, I think makes their job more interesting and makes them feel valued also.
That's awesome. Has it helped? I'm just curious for my own sake here. Has it helped with retention as you do that with your employees? Do you tend to keep your dental assistants? Do they stay longer because they feel like there's an investment in them as an employee?
I hope I do. I've been pretty good with dental assistants. I had to lose my last one because she got married and she moved an hour and a half away. So
you can't control that one, right? That's just life happening.
Yeah.
So let's jump in. I mean, it sounds like you're kind of on the cutting edge. And dentistry is changing quickly. So I'd like to get your perspective here and what trends you see in dentistry right now that are changing the industry.
Well, the big trend, of course, is AI, right? So I don't know if AI more for, I think, in a practice management way, in terms of virtual assistants, helping your practice management, retrieving patients, helping patients schedule. I think that with CAD/CAM, it's more of a machine learning as opposed to an artificial intelligence. But with the artificial intelligence that's coming out now that is becoming very popular is things like Pearl and Overjet, where they can look at your x-rays, your 2D x-rays, and help diagnose whether there's a possibility of cavities or caries or decay, or if there's bone loss. I think that helps a lot also with patients, because you can present now to the patient, look, here is this x-ray, you have a cavity here it's in this color, do you see it? As opposed to trying to get them to understand, various shades of gray, which they're not going to really appreciate. They may say, yeah, I see it, but they really have no idea.
We don't. You trust me, I'm one of those patients. It's just a different shade of gray. So do you use an Overjet or a Pearl in your practice?
I'm using Pearl. I'm going to be switching to Overjet. They're both really good. I really like the ability, like I said, to explain to a layperson, what's going on. And they appreciate, because I think when they understand that, you can see in their eyes that they all of a sudden they're like, oh, okay, I see that. I get it. I see why, we have to do this filling.
Well, yeah, thanks for bringing that up, because I was going to ask that next. Is like, do you see, because it seems like you're really having your patients be involved in the whole journey of getting their smile restored. If they were like it was the light bulb went off and they would see it
and
on
you know,
the
patients
highlight.
really appreciate when you have technology because it shows that you're keeping up with the world. So they're impressed by it. They are fascinated by it. They're just like, wow, this is so cool. So technology, AI, it's all part of what you have to do. And it helps make your life easier as a dentist, honestly, having these things available for you. It helps you practice and create and restore and treat your patients better.
Okay. Well, what's one piece of advice you'd give to a practice owner or somebody running a practice that is looking to elevate their offering?
I think you do have to bring in technology. You don't have to be afraid of it. I think I once heard a lecturer who said, this doctor had been told they can't purchase a digital scanner because it's not in their budget. But the thing is, budgets were based on last year's revenue, and bringing in a scanner is going to increase this year's revenue. So you can't hold yourself back because you're afraid to spend that money, because the money will drive in more revenue. So you just have to embrace it. But when you embrace it, you have to use it. You have to take the continuing education courses. You can't just buy it and leave it there and be frustrated because you don't know how to bring it into your workflow properly. You need to actively seek it out. It's kind of like, when you go buy a treadmill and you bring it home and use it for the first month, and then you just use it as laundry hanging after that. You need to not put that scanner or that mill or that 3D printer aside. You need to learn how to use it. You need to teach your staff how to use it and make it part of your routine.
That's a good thing you bring up, because I come across that often in my role here at CareStack. Mm-hmm. How do you get the team members to adopt this new technology, whatever it might be, a scanner or AI at answering the phones or AI on digital radiographies?
You have to be excited yourself.
Okay.
Because I think if you are a dentist who just says, oh, we're going to start this here, throw it at you, you have to learn it, they're going to be like, oh, this is more work. But I think if the doctor themselves is excited by it and they provide the training for it and they're involved with it, I think that's going to make a huge difference in terms of staff going on board.
Okay, so it's got to come top down.
Yeah.
To be successful. Okay. So going into the business of, cosmetic dentistry, mm-hmm. How do you approach growth and patient acquisition in a specialty like that?
It's word of mouth. For me, it's word of mouth. I do some posting on Instagram. It's more of a patient has had a great experience in my office, and they will tell the next person who they have a friend who says, oh, I really hate this crown that I have, and that person, my patient, will be like, oh, you have to go see Dr. Chang because she listened to me and she did a great job. I'm really happy with what I have. I find that mass marketing doesn't work for my type of practice because I'm looking for certain clientele. And I just believe that if you take care of your patient, you treat them like another person, you listen to them, it's going to drive itself, the internal referrals.
Okay, so you're more focused on organic growth. Is that maybe a good way to put it? Just patients telling their friends and family and coworkers. No, that's awesome. So you're a very tech-forward practice, it sounds like. So I'm going to jump past my next question of technology adopted. Okay. And I'm just going to ask, what specific tool has helped you the most that you've adopted in your technology stack?
You mean like which parts of technology I've liked?
Yeah, a particular tool. It could be anything that you use on a day-to-day basis that it's technology focused that has helped you grow your cosmetic business.
So I've got like everything. I've got 3D printers. I've got a laser that cuts hard tissue. I've got my mills and my scanners. I still think chairside dentistry has been a big driver of the cosmetic part of it, because I can have a patient come in and do a 2, 4, or 6 unit anterior case, the canine smile. I can have it scanned, prepped and scanned. For a complicated case like that, I actually will work with a digital lab who will then design it at the spot. We make an appointment, they do the designs, they will send that back to me. I will then proceed to mill and process the restorations and do all the final touches on it. So I still believe chairside is going to be the most revenue driving piece of technology, and it also provides you the tool and ability to create your aesthetic components.
Okay, yeah, thanks for sharing that. So I'm going to shift gears and go over to the personal side.
Okay.
So I want to know, Dr. Penelope Chang, a little bit more on the personal and just throw these out there as I ask them just what comes to mind first.
Okay.
How do you give back to your community, either through your practice or yourself?
So in the past, I've been on the board of health for my town, so I've helped participate with that. We used to do a candy buyback. So with the elementary schools, we would do a drive every year at Halloween, and we'd say, bring in your candy, we'll weigh it, and for every pound that's brought in, we'll donate $1 to Tomorrow's Children's Fund. And in that way, we keep the kids aware of, don't eat all that sugar when you don't need to, just because you've collected the most, and then what we do with that candy is we donate it either to like a shelter or something like that where they can take advantage of it.
Okay, nice. And what's one book, podcast, or resource that's helped shape you as a leader or just in general for leisure that you enjoy?
I have to say, actually, CEREC Doctors, which, like I said, is a continuing education group. They have a board. The group of doctors on this board is just amazing. We can talk to each other. There's no judgment. Everyone is open. Everyone will answer questions. They will help you out without that judgment that you might see in other social media platforms. And they've been instrumental in helping me define myself in a way, like, how to deal with issues and problems, how to make things better. That one is super important. And the other one I have is Mommy Dentists in Business. It's a group of women who are moms who are also dentists. And once again, it's a safe zone where you can talk about things or question things and not have any snarky comments made back at you.
No, that's great. I mean, because I love that you're out there sourcing it amongst your peers. Mm-hmm. And crowdsourcing your information, because you're not ever going to be the only one that's gone through something, right?
And most people are afraid to ask the questions or say it. They think they're always the only one with this issue, but there's so many people out there with the same issues.
Oh yeah,
and
difficult
have a safe
patient
place to really talk about stuff like that is great.
I know the mommy dentist one's been a big one. I know a lot of people come to that looking for CareStack. It must be a great group that it's just out there talking about their business. Yeah. That's fantastic. And what's your go-to to unwind? So when you clock out for the day, what do you do?
So I've worked all day. I've talked to people all day. It's amazing how much you talk to make people comfortable, and they talk back, which is nice. I like to read a good book. In fact, I just like to read. So I like to come home and open my iPad and just dive into somebody else's story. I don't have to talk to anybody. I don't have to listen to anything. I can just sort of go, to those places. But don't ask me what I'm reading right now, because I read so fast and so much. I can't even give you like a recommendation right now.
Okay. Well, how about fiction or nonfiction?
Fiction.
Fiction. Okay. So you really want to just get into a story and decompress.
Yes.
And okay. I'm with you there. It can be exhausting as you sit and talk to people all day long. And I couldn't imagine.
Yeah, I feel bad. When my kids were younger, I would come home and be like, I don't want to talk to you guys. Don't talk to me. Because I've just, helped everyone else solve their problems. But no,
How many kids do you have?
I've got 2.
Boys?
2 boys.
Okay.
No one's going to be a dentist.
They're not going to be a dentist? What? Are they at that age where they're deciding what they're going to do?
Yeah, they are.
Any ideas or?
Not right now. They're still, times are changing. AI coming in has changed a lot of things in terms of jobs.
Yeah, agreed. I have a 16-year-old, and it definitely changes the scope of what they have to think about in the future, which is very different from when we were younger, right? You could go with certainty. World.
It's like the era has changed, and it's shifting over to something else now.
Okay. Well, Penelope, this has been a super insightful conversation. But before we close, I just want to ask one more question.
Okay.
When you look back at your practice and what you and your staff have built and the impact you're having on your community and the way you treat them, what are you most proud of?
I'm proud that the patients continue to come to see me and appreciate what I do for them and how they refer. On kind of a segue of that, when you talk about what have you left behind, when you've passed over, what have you contributed to society?
Yes.
And it's a hard one, right? Like, what have we done that people will remember us for? And I realized that because I am creating these miniature sculptures and putting them in people's mouths, that's kind of my legacy, because I've created artwork and it's living with them and they're functioning with it and they're smiling with it. So I am leaving behind a piece of me inadvertently with all these people with every restoration I do. So
I love that perspective.
It's kind
So
of
as an
cool.
artist, it's out there walking around every day
Yeah.
amongst
It's functional
thousands
art.
of people. Yeah. Well, thanks again, Dr. Penelope Chang. It's been a pleasure having you on the show, and thank you to everybody listening. That's it for this episode of The Doers, where we share the stories behind the work and the wins and the lessons learned. If you enjoyed this episode, be sure to follow us and stay tuned in for the next episode. And until then, just keep doing the work.